A new hope, unlocking the power of maternal RSV vaccines. A global health revolution is upon us. As we step into the future, the year 2025 has brought us closer to a groundbreaking development in infant health protection. With the World Health Organization, WHO, leading the way, countries are now empowered to take action against a major health threat, respiratory syncytial virus, RSV. The journey so far. In March 2025, a significant milestone was reached when WHO pre-qualified a maternal RSV vaccine, Abrysvo by Pfizer Incorporated. This vaccine has since been recommended for global use, with the Pan-American Health Organization, PAHO, also endorsing its potential. The momentum continued with Gavi, the Vaccine Alliance, committing to fund an RSV maternal immunization program, especially crucial for low- and middle-income countries, LMICs. The next steps: accelerating protection. Now, countries have the green light to explore the introduction of RSV vaccines and other preventive measures. An urgent task is to fast-track the WHO pre-qualification process for a multi-dose vial presentation, tailored for LMIC markets, potentially as early as 2026. While long-acting monoclonal antibodies are also recommended by WHO, their high cost and limited supply pose challenges for many LMICs, requiring innovative solutions to ensure accessibility. A foundation for change. WHO's recommendations and guidance offer a solid framework for countries embarking on this journey. Although the introduction of the maternal vaccine in LMICs may still be some way off, the groundwork is laid, and preparations can begin to safeguard the health of countless children in the future. Protecting mothers, safeguarding newborns. RSV is a formidable adversary, being the leading cause of severe respiratory infections and hospitalizations in infants and young children. Its reach is vast, with almost all children contracting the virus before their second birthday. The disparity in RSV mortality between low and high-income settings is stark, with 98% of pediatric RSV deaths occurring in low and middle-income economies. Many of these children never even make it to a hospital for treatment. Clint Pachenka, director of PATH's RSV vaccine project, emphasizes the critical nature of this issue. RSV is a major cause of infant illness and death, particularly in resource-limited settings where some children never even reach healthcare facilities. Maternal vaccination offers a vital opportunity to reduce this burden, protecting babies from the start and alleviating pressure on families and healthcare systems. Preventing the unseen threat. The maternal RSV vaccine is a powerful tool, offering protection to babies during their most vulnerable period. Administered during pregnancy, the vaccine boosts the mother's immunity and enhances natural antibody transfer to the baby during their first few months of life. WHO globally recommends vaccination in the third trimester of pregnancy, as defined by local guidelines, to ensure optimal protection. The impact of RSV vaccines. Pfizer's maternal vaccine has demonstrated impressive results in clinical trials. A Phase 3 clinical study revealed that the vaccine's protection remains high for the first 6 months after birth, with an efficacy of 82% in the first 90 days and 70% after 180 days. These findings indicate that the vaccine can effectively shield children during their first 6 months, the period when RSV poses the greatest risk to their health. Real-world data from countries like Argentina, which have introduced the maternal RSV vaccine, further supports its effectiveness, particularly against severe disease. This vaccine not only keeps children out of hospitals, but also reduces healthcare costs and frees up resources for other critical health priorities. Ranju Baral, a senior health economist at PATH, highlights the economic viability of maternal RSV vaccines. Our cost of delivery analyses in Kenya, Ghana, and Mozambique show that the estimated costs of delivering new maternal vaccines, such as for RSV, are comparable to those of other routine childhood vaccines. Modeling studies also indicate that these vaccines can be cost-effective in many LMICs. Once vaccine pricing for LMIC markets is available, we can confirm this optimism, suggesting that maternal RSV vaccines could be a wise investment in maternal and child health where it's needed most. Expanding horizons, access to maternal vaccines. WHO's recent recommendations on RSV vaccines build upon a successful history of maternal immunization. Maternal vaccines for diseases like tetanus, influenza, and pertussis have been making a positive impact for years, and new vaccines are in development for pathogens such as Group B streptococcus. Maternal vaccines offer unique advantages, providing protection to both the mother and the infant, and offering a safety net during the infant's early months when certain vaccines are not yet feasible. As more maternal vaccines become available, PATH is conducting research in Africa to assess adoption readiness and explore delivery requirements in Ghana, Senegal, Tanzania, and Zambia. PATH's work in these countries, as well as in Mozambique, Vietnam, and 5 countries in the PAHO region, is providing a comprehensive understanding of how current antenatal care visit timing aligns with recommended RSV maternal vaccination windows, informing implementation strategies. Sadaf Khan, a program advisor for maternal, newborn, and child health at PATH, emphasizes the importance of this research, understanding the intersection of antenatal care and immunization programs is crucial. We are identifying potential challenges, assessing workforce readiness, and addressing gaps to ensure countries are equipped to roll out these vaccines successfully. Turning potential into reality. With the single-dose vial presentation of maternal RSV vaccines now pre-qualified, the time is ripe to prioritize their rollout planning. As countries plan for RSV prevention, they must consider the local impact of the disease, the cost-effectiveness of available products, and the compatibility of these products with their health systems. By enhancing RSV surveillance efforts, countries can advocate for vaccine introduction and identify areas where their impact will be greatest. Other critical steps include preparing delivery platforms through antenatal care and immunization programs, raising awareness among healthcare providers and caregivers, and ensuring systems are in place to monitor safety and effectiveness. Long-term success will also hinge on workforce readiness and securing sustainable funding. WHO, PATH, and other stakeholders have developed a comprehensive suite of communication materials covering RSV disease, new prevention tools, and delivery considerations. These resources aim to support informed decision-making and implementation planning around RSV and relevant interventions. A brighter future for infants. Maternal RSV vaccines hold immense promise in protecting infants from a deadly threat that has long been overlooked. By paving the way for their introduction, we can ensure that countries are well prepared to implement this life-saving intervention in the years to come.